Hi everybody. Today we're going to do a presentation for the appropriate treatment program with special consideration for ethnic minority groups like the Black or the Latino or any other minority group that exists. The purpose of this presentation is to explore the unique consideration for this group of people, especially as it relates to the treatment settings, the type of model of addiction to be adopted, and also the necessary cultural consideration involved. Before we discuss the treatment program, let's first of all look at the reason why we are doing a special consideration for these ethnic minority groups. As we all know, we cannot deny the fact that this group of people already face some kind of stereotyping, especially when it comes to them facing some unique challenges. Apart from the stereotyping these people face, they also face some cultural stigma when they are involved in addiction, be it alcohol, be it drug, be it gambling, any kind of addiction or whatsoever. There is this cultural stigma that is attached to them. And worst of all, when they are seeking sobriety and they are trying to get healed, there is always a barrier to treatment for them due to the nature of their race or their ethnic group. So that is why today we are focusing on a treatment program for this group of people. So for the benefit of this presentation, our focus would be the outpatient treatment program. The reason is because the outpatient treatment program allows for these people to be able to engage with their community and while they are receiving treatment at the treatment center. Outpatient treatment system is the type of treatment where the patient goes from their residential place of abode to the treatment center. The outpatient treatment program, it focuses on providing structured program that incorporates culturally relevant practices, especially as it relates to these people and their way of life, such as family involvement and the access to community resources, which are very, very, very crucial for the healing process. To help them reach this healing process, we would incorporate the biopsychosocial model. The biopsychosocial model effectively addresses the interplay of biological, psychological, and social factors that influence substance abuse, especially for the population in question. It is particularly important because it allows us to consider cultural influences and the impact of the community and family dynamics. You cannot administer treatment on a patient without taking these factors into consideration. So the biopsychosocial model is an effective model for this treatment program. As for the structure of the treatment, now we'll also look at the structure of treatment. The structure of our treatment program includes several key components like comprehensive assessment, individualized treatment plans, and a blend of therapy that incorporates cultural themes as well as family therapy. This holistic approach helps us ensure that we meet the unique needs of this particular client or patient. Now, to the main crux of the matter, how do we begin to guide individuals or the patients to sobriety? The main goal of the outpatient treatment plan is to guide individuals through a structured process. This process provides education. It focuses on providing education about addiction. Now, not just providing education about addiction, it also provide education that is culturally relevant to the patient. For example, it teaches them coping strategies that resonate with their personal experience or with the experience of somebody they know or somebody they can relate with, and also offer emotional and spiritual support when necessary. The educational process also emphasizes on relapse prevention techniques, because there is a high chance of relapsing when an individual decides to seek help or pursue sobriety. So the education also focuses on relapsing techniques and how to prevent it. For example, we all know that habits, when you resist a habit, it fights back. So the education is structured in a way that it teaches the individuals how to replace habits instead of trying to fight that habit. Replace it with another acceptable hobby or another acceptable activity. So that whenever they think about addiction, what they are addicted to, instead of engaging in that, they go do the new hobby they have adopted. The next thing I want to also talk about is the rationale for this treatment, which is the outpatient treatment setting. Now, somebody might be tempted to ask, why did we choose this treatment plan? Why did we arrive at it? First of all, I want to say this treatment plan is not the only model or the only type of treatment program that is existing. There are various models of addiction program, and there are various levels of treatment. But the reason we arrived at this outpatient program is because we consider the factors involved. Factors like the level of care required, the cultural relevance of the service that we are providing, and also the accessibility to community resources. For example, a person of color will feel more comfortable and more relatable with a counselor who has the same experience and background as him. He will be more open to tell their personal stories, to talk about their weaknesses and inadequacies without the fear of feeling judged or without the fear of feeling stigmatized or condemned. Personally, I remember when I was in therapy, I remember my therapist encouraging me to become a counselor because of the shortage of people of my race in that profession. She encouraged me to go ahead and pursue this career, and that's part of why I'm here. So because she believes that the patients will feel more related, will feel more heard and understood talking to somebody that looks like them. So that is part of why we chose this rationale and this setting, this treatment program. There are some responsibilities that are expected of the SUD counselor, the substance use disorder counselor. These responsibilities are focused around 12 core functions, which include screening the patients, the intake process, the assessment process, the counseling process, the case management process, and so many more other. There are about 12 core functions. I don't want to bore you with. But then it's crucial for substance use disorder counselors to understand cultural dynamics in order for them to be able to provide effective care. Also, as a substance use disorder counselor, some certain skills are particularly beneficial for working with ethnic minorities. For example, cultural competence. You have to be vast in certain aspect of that culture. For example, the music, the entertainment, the politics of that culture. It gives you the ability to engage in trauma-informed care and strong communication skills that resonate with people. In conclusion, I would simply say that creating culturally competent treatment program is very, very essential for addressing the unique needs of ethnic minorities. That way they feel heard, they feel understood, they feel cared for. These are people who have been dealing with years and years of stereotyping and discrimination of all kinds. So this type of treatment program needs to be encouraged and advanced. Not only that, ongoing education is also essential to help the counselors stay informed about culturally relevant practices and pop culture, basically. So I want to thank you. If you made it this far, I want to thank you for watching, and I hope you found this information valuable and enlightening. If you have any questions or would like to discuss this topic further, please feel free to reach out. Thank you.